let's look at the delivery region.
So I think of both of these as falling into trying to solve, well, actually probably the first one, more of solving an access issue. So a lot of what we hear in healthcare right now is access to care. Urgent care, for example, retail health fits kind of into that. And I do think patients feel that.
At the same time, though, the issue of redesigning the workforce is huge. Most hospital CEOs that I've talked to in recent weeks have told me that workforce is their number one issue. I mean, I haven't heard that in a long time. That is the issue.
Some of the approaches of retail get at non-traditional health care delivery and really talk around prevention and helping people live healthier lives. And I do think that's an opportunity where I think retail's leading health systems who maybe are mostly playing the role of connecting people to community resources, but really not making their own investments there. And I think that's a place where retail is leading the way in this country.
Rise of retail health is red. Redesign of care team training 8 is black.
If there's a tougher matchup to call in the first round or the second round than this, I don't know what it is.
Women's health isn't just one thing, right? Women's health, we've talked about clearly women as decision makers and for health and health benefits.
And I have to agree with Aisha, women's health is a huge category. And I will say it encompasses Alzheimer's. Most people who have Alzheimer's right now and are needing care, vast majority are women.
Point. Red for investment in dementia and Alzheimer's. We'll go black for focus on women's health. Black, 4-0.
There's a need for new thinking entirely about how care is delivered and who needs what and how we're focused on the needs of different populations.
I just don't know, to something David said earlier, if the more traditional systems that would be delivering more sophisticated care or hands-on care know how to meet that consumer where they are.
So I just think by necessity and through innovation, we're in the midst of a transformation of our workforce in healthcare, and I think that's the stronger team here.
Red for the leveraged delivery model, black for the population-specific model.
I'm bullish on both of these trends as really important topics and huge opportunity, but really bearish on whether 2024 we're going to see significant improvement or advancement in either.
My non-scientific polling of employers that I know, who I talk to a lot, is that this issue is the number one issue for them. I mean, this is huge. So I think most employers that I talk to also really love the idea of integration. They love the idea, why do we separate the head from the rest of the body and say mental health is some separate, that's when you're on Mars, you deal with your head. Well, that's ridiculous. It's got to be part of your overall physical and emotional health.
Red, mental and behavioral integration, and let's go black, investment in preventive health. Red.